Hello, my fellow Ohioans, and today is April 1st, 2020, and this is your Ohio coronavirus update in a matter of 5 minutes or less. First, we're going to take a look at the numbers. The total cases reported or infected people today went to 2547 with a daily increase of 348, which means we may be at the point where we're starting our upward trend. Total tests to date 31,738. This was actually done manually. I basically added the 2547 that based on the 2547 that have tested positive. The math just kind of worked itself out where essentially the increase was also 2547 tests, but they did not report today how many total tests they actually did from between yesterday and today. So, or the total test overall for that matter. So all I had to use was the number of positive tests and did the math, and it just worked out to 2547 for both of these numbers. So not much to really talk about there. What I do want to talk about, however, are some bullet points that were brought up in the meeting today. First things first, actually not related to a bullet point. This is an article that was released by BBC.com that actually talks about Governor DeWine in a positive light. I will leave this link in the description if you want to go check it out. But it was basically saying like, hey, Mike DeWine was one of the first governors to start preparations before one of the first cases was found in the state. So clap, 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 clap for Ohio. All right. So next thing, the points talked about today was that they're dividing health zones into three regions. Normally there are 8 zones, but they're basically dividing them into 3 regions: Cleveland, Columbus, and Cincinnati. The location of a health region doesn't necessarily dictate where someone might be hospitalized, but generally speaking, they're saying that based on where you are in one of these regions will dictate loosely where you end up being hospitalized if you test positive for coronavirus and you require hospitalization. They mentioned that there are possible buildups of new hospitals and areas forthcoming. They didn't provide too many details on that just yet, but they said it's most likely going to happen. The National Guard will be helping hospitals with expanding capacity, so existing hospitals will be expanded or finding other locations like college campuses and stuff like that to be used for hospitalization. There is an Ohio Manufacturing Alliance that was just formed. He put it into order, I believe, today to fight COVID-19, where public and private entities will be providing personal protective equipment to healthcare workers. He's basically asking, just like Trump did from the national level, to help ask the major manufacturers to provide PPE for healthcare workers. Governor DeWine is basically enacting a similar executive order. He signed the executive order live on television today for Ohio to start doing this. So for Ohio businesses to come forward and start helping put together PPE. There is a website that if you are a small business, or if you're a business, well, I don't know why you'd be listening to me, but if you're a business and you don't know about this, check out repurposingproject.com. I will put that link in the description. It basically tells any business that has the ability to make this equipment what the needs of Ohio is and how they can help. So Dr. Amy Acton signed an order on live TV as well today for hospitals to send tests that mandates essentially hospitals to send tests to labs that can turn around the results faster. So they've been saying for days that there's certain labs that don't have the ability to turn around tests within a couple of days or less. They sometimes hospitals are sending these lab tests to labs that take 5 days or more to turn around. They said that is unacceptable, and the order she signed today basically mandates that hospitals need to send them to labs that have the capacity to turn test results around faster. The order includes use of rapid tests when Ohio gets them, and that should be possibly within the next week. So the rapid tests being the ones that like Trump unveiled about a week ago. Emergency departments, urgent care centers, hospital, multi-use healthcare facilities will also be used for these tests as well. So allowing greater opportunity for people to get tested. The labs are going to 3 shifts to get results turned around faster. There was a FEMA disaster declaration yesterday for Ohio that gives the Ohio government funding up to 75% in particular areas related to COVID-19. An executive order will be signed by Mike DeWine to help small businesses stay afloat for Basically, it's a plea to lenders and landlords to suspend payments for up to 90 days. Uh, some of the recommended advice today was to wear a mask or gloves while you're going out and doing shopping to protect yourself, others, and people in those grocery stores. Wash your hands before going to the store and after coming home from the store. Uh, Dr. Acton did comment that thinking that this would be over by summer is unreasonable, and DeWine Mike DeWine did say that if you see gatherings of people not abiding by the social distancing practices, to contact your local health department. I will. I want to throw up here real quick a map. Let me see if I can find this. I have too many damn tabs open here. So I will mention. I do want to show this. So on the COVID-19 dashboard, I know this is exceeding 5 minutes. They have the forecast model from Ohio State University that's actually an interactive map. This is actually the same model that they're using to show that they're expecting the peak number of new cases to take place around late April. And as you scroll more to the right, you can see that it's tapering off sometime into the end of May, early June, where there's fewer and fewer new cases. Now, does this indicate that the social distancing will extend for this period of time? It may. It may not. It depend. It's all going to depend on whether or not there's a vaccine or anything else that comes along during this time frame that helps things out. I don't want to keep this going for too long, but I did want to get that out there for you to take a look at as well. And I hope you guys enjoy the daily updates. I'm trying to do them as fast as possible. A lot of information to condense in a short period of time. And until I see you guys again, bye-bye.